Up until the 1920s, there weren't very many commercial health insurance companies. The reason was mainly due to companies fearing not generating enough profit. So when medical care started to improve, so did the prices for medical services. Due to the high increase, teachers were no longer able to afford to pay for their medical bills. Justin Ford Kimball, an administrator for Baylor University of Texas, noticed the financial burden and stress that was brought upon them, so he came up with a health plan to help make it more affordable and to put their mind at ease if they ever got sick and needed hospital care. His history-changing plan was to have teachers pay a small fee of $6 a year in exchange for up to 21 days of hospital care. There were more than 1,000 teachers that signed up to be covered under the plan, and by 1934, Kimball's plan was officially established and named Blue Cross. Then a similar health plan emerged from the West for lumber workers and miners that was named Blue Shield. In a very short time, the prepaid health insurance model became very popular all over the country because of its affordability. In 1939, the two companies, Blue Cross and Blue Shield, collaborated in Michigan to mandate the regulations on prepaid insurance, as well as making them nonprofit. The Michigan Society for Group Hospitalization was contracted with over 350 employers, which generated more than 175,000 customers. And soon after, they changed their names to Michigan Blue Cross and Michigan Blue Shield. Fast forward 20 years, more and more people gained coverage. In 1966, the U.S. had Michigan Blue Cross and Michigan Blue Shield take the responsibility in implementing Medicare in the states. In 1978, the organization purchased an HMO that was struggling to operate. And fortunately, within 12 years of the Blue Care Network taking over, it became the largest HMO in all the states. And Michigan became the first state to earn accreditation from the National Committee of Quality Assurance, which is now recognized as the top HMOs in America. Since the 2000s, they had implemented new standards and revised their mission, which has reduced the cost of healthcare and improved the overall quality of health in the communities. Some examples include, in 2001, the promotion of genetic drugs. Between 2006 and 2007, healthier individuals were incentivized. In 2009, the Patient-Centered Medical Home Program was launched. In 2014, the company became a nonprofit mutual company. The company believes that by allowing the members to have a stronger voice, it will help guide the company towards implementing what is best for the customers, which ultimately is to have access to quality health care and be the healthiest they can be, as well as to grow along with the changes. Telehealth can solve many problems we are facing today in healthcare, which in many ways is the missing component that has yet to be fully integrated into our healthcare system. Congress has not yet approved for Medicare reimbursement for telehealth services. Especially in today's highly technical world, this technology changes the way providers can treat, diagnose, and monitor the health of patients from any location as long as the patient and doctor have internet access. In 2013, a new health plan called Live Health Online was launched through WellPoint's affiliated health plans. They provided an online care service to national employers, and now the coverage includes their health plan customers. These benefits include daily access to board-certified doctors 24/7, including holidays. Their members can browse for doctors in their area that suits their medical needs, as well as see ratings of their services before deciding who they want as their provider. The basic care that comes with this online medical service are diagnosis of acute conditions, such as the flu or sinus infections, to regular checkups. And depending on certain states, doctors can send their prescription to their pharmacy through this online service. What drives people to want to use this service is the convenience of seeing a doctor in a timely manner, at any given location, using a smartphone, tablet, or computer with internet access. Urgent care centers and ERs are dreadfully slow and expensive. According to the Association of American Medical Colleges, they estimate that by 2015, approximately 62,900 additional doctors will be needed. Living in rural towns has its challenges when it comes to healthcare. It can be difficult for patients in these types of communities to see a general physician and especially a specialist, because their providers sometimes are hours away, located in bigger cities. Not only does this service help patients have easier access to quality care, but the cost of using this service is much cheaper than regular in-person doctor visits. The cost can range from $25 to $49 per visit. It has also reduced the cost of medical care compared to an ER visit or an urgent care, and allows patients to stay in the comfort of their convenience zone. WellPoint's affiliated health plans and many other Blue plans across the country have recognized how telehealth can minimize the gap in healthcare access and lower the cost of essential healthcare for patients, which is why this service is on the rise. But there are a couple disadvantages. Congress has not yet approved medical reimbursements for telehealth services. Also, another disadvantage of telehealth are the limited services that can be accurately assessed through video chat, like regular checkups, diagnosing, or follow-ups. A physical exam would be rather impossible to get accurate and honest results, having it done in this technical manner. However, the benefits greatly outweigh the disadvantages. It provides the convenience for patients to not have to travel and wait on seeing a doctor, which brings me to talk about the next benefit. Not only does telehealth have potential to increase access to care to the entire world, it also has the potential to increase better outcomes for patients who are diagnosed and treated early on. This reduces mortality rates, complications, and even the likelihood of hospitalization, which brings down the overall cost in healthcare expenses for patients and insurance companies. Technical devices can help monitor patients without having to physically be there under doctor's scrutiny. Another advantage of this new model of care is helping mental health patients in their most comfortable way possible. Mental health is widely among us. According to the National Institute of Mental Health, millions of people suffer from mental illnesses, but only half of this population of people are proactive about seeking treatment. Depression and anxiety seems to be more common than ever. Anyone who suffers or has suffered from depression may understand that sometimes an act as mindless as getting out of bed can be a real physical challenge. Or any patient suffering from anxiety, leaving the house and driving in traffic can be torturous. This is where telehealth can be incredibly helpful to mental health patients. So what is managed care? It is a system of healthcare delivery where patients are allowed to visit certain physicians and hospitals. Quality and the cost of these medical services are monitored by a managing company. There are several designs used in managed care. HMO, PPO, and HSA are the plans that the Blue Cross Blue Shield offer their members. An HMO plan is when a primary care physician is the gatekeeper. This means in order to see a specialist, a referral is needed prior to the visit, or the insurance will not pay for the specialist. HMOs require that a majority of services that a person would need are available within their organizations. Like a one-stop shop, physician visits in specific hospitals are required to be in-network, or the insurance won't cover the visit. A substantial amount of HMOs are accredited with either the National Committee on Quality Assurance or Accreditation Association for Ambulatory Health Care. A high percentage of BCBS plans are service plans, which are now known as PPOs, which means plans are directly contracted with providers and hospitals. Within these contracts, it is stated that providers are paid from the plan and members are not billed. Members are responsible for copays, coinsurance, and deductibles. PPOs have stricter utilization management requirements. With the Physician Choice Preferred Provider Plan, like other PPOs, you can choose your own physician in or out of network. If members go to physicians or hospitals out of network, they will be responsible for the allowed charges, which is the max allowed for the differences between what the provider charges and what the plan's max payout. So if a physician is chosen out of network, the costs are slightly higher for the member. Health Spending Account is another plan offered by BCBS. There are 3 designs offered: Health Savings Account Plan, Health Reimbursement Arrangements, or Flexible Spending Accounts. Blue Cross Blue Shield is a massive organization, as affiliated insurers are responsible for approximately 48% of all commercial health insurance, as well as 40% of total health enrollment nationwide. As their sheer size may suggest, BCBS and Healthcare Service Corporation, BCBS's parent company in 5 states, are incredibly profitable. In 2017, the company raked in $1.3 billion in net profits on $32.6 billion of revenue. Of that revenue, $1.4 billion was made from ACA plans sold on the individual market alone. All of this suggests that despite the political infighting in Washington in regards to healthcare, HCSC and other healthcare organizations are still managing to pull in massive profits. HCSC and BCBS managed to stay profitable by increasing their premiums in order to curb changes made by the Trump administration. BCBS parent companies in Illinois, Montana, New Mexico, Oklahoma, and Texas collected $32.5 billion in premiums in 2017, marking a growth rate that is 7.4% greater than the average annual growth rate. This was despite premium revenue being down 3% from 2016. Taking all of this into account, BCBS was very successful and profitable in 2017. And according to Mark Ferrara Associates, an organization that aggregates healthcare industry data for business analysis, quarterly growth in 2018 suggests that this trend of profitability should continue well into the future. This is also demonstrated by the fact that there has been steady annual growth in profits since the Obama administration. In 2014, HCSC was actually not profitable, losing $281.9 million, likely as a result from the chaos of the implementation of the ACA. Despite this trend of net losses continuing in 2015, as HCSC lost $65.9 million, it was clear that things were looking better for the healthcare market. This all came together in 2016, when the HCSC posted net profits of $106 million with $30.3 billion in revenue, marking a major shift in profitability for healthcare organizations. And of course, in 2017, HCSC posted profits of $1.3 billion, an over $1 billion increase from the prior year, proving not only HCSC's profitability but also their growth. Luckily, BCBS is a nonprofit organization and has committed to 2% pledge, donating back any profits over 2% of the revenue to their local communities. Over $500 million has been given back to California communities since the implementation of this pledge in 2002. Individual plans are tailored for small businesses with fewer employers through an insurance agent who can direct them to pick a plan that fits their specific needs. Group insurance like BCBS is a health policy purchased by the employer, who offers it to the employees and their dependents who are eligible. These plans are selected by the employer, who shares the cost with the employee, who pays a minimum amount to the insurance plan. Big employers are required to offer insurance if there are more than 100 full-time employees. The penalty can cost big employers $2,320 per employee, including the first 30 employees of the company. The company has to either offer affordable minimum essential coverage that provides minimal value to your full-time employees and their dependents, or they could owe an employer shared responsibility payment. Wages of more than $200,000, big employers must report and withhold 9%. Small employers are required to offer insurance to employees if there are more than 25 full-time employees or 50 part-time employees. Qualifying employers must pay 50% of the healthcare costs based on the single rate. Having insurance can create the opportunity for tax exempts. Affordable insurance can be purchased through small business health option programs. CareMore is a Medicare Advantage plan that considers itself a radical healthcare. CareMore is changing healthcare by focusing on value-based care and choosing high-risk patients with illnesses that only healthcare plans would see as a risk to take on as patients. Through preventative care, they are able to keep costs down to a minimum, saving patients and focusing on helping a person get better. They are a BCBS contractor and use physicians who are providers to this health plan. American Well is a telehealth program that allows patients to receive care without having to go to a physical office. Using Blue Cross Blue Shield physicians and nurses, patients are able to have easier access to health care. American Well focuses on bringing telehealth to healthcare providers and to the patients. Using clinical development data, it is easier to schedule online appointments while maintaining value needed in the healthcare field. The level of care ranges from urgent care to chronic care, post-surgery, and behavioral health, and so helps other care needs as well. By using EMR technology, BCBS patients and their physicians have access to their records from their past and the current plan of care. American Well allows BCBS to focus on patient engagement by having applications, kiosks, provider applications, and telemed tablets.